Pregnancy can be one of the most exciting times in a woman's life. But for some, it is also comes with higher risks and tougher decisions. That's where today's guest comes in. Hello and welcome to the Main Health Show. My name is Stephanie Anderson and I am your host. I am excited to share today's guest with you. She's an expert in navigating high-risk pregnancies, helping moms and families feel informed, supported, and prepared every step of the way. I'm so glad that she's here to share her knowledge and her experience with us. But first, allow me to share a little more about her. Dr. Luissa Kiprono is a refugee from former communist Romania, high-risk pregnancy physician specialist, Air Force veteran, founder and CEO of two enterprises, Telemed, MFM, and Dr. LuissaK Foundation. Through her telemedicine practice, Telemed MFM, she provides quality and equitable high-risk pregnancy care to women beyond borders or geographical limitations. Over the past 2 decades, Dr. Kiprono has emerged as a strong advocate for women in medicine and leadership through one-on-one motivational development, speaking engagements, international humanitarian medical care, and community service. Dr. LuissaK Foundation was born as a calling to empower women everywhere. Her own triumph over trauma inspired this movement for all women to join in self-empowerment, intentional presence, and resilience. Her recently published memoir, Push, Then, Breathe, Trauma Triumph, and the Making of an American Doctor, is based on Luissa's first 15 years of her reborn life here in America. In this book, she shares her shattering story of physical and emotional abuse, how she overcame her past, rebuilt her own future, and is now helping others in their own healing journey. Since 2019, Luissa has called San Antonio her home, and this is where she lives with her family. She is a triathlete, an Ironman finisher who enjoys immersive travel and eclectic cooking. Help me welcome today my very special guest, Dr. LuissaK. Dr. Luissa, welcome and thank you for being a guest on the Main Health Show.
Stephanie, it's a pleasure. Thank you for having me, and thank you for allowing me to speak to your audience.
Yes. I was introduced to you and the phenomenal woman that you are and everything that you're doing through, an electronic introduction
Yes.
from someone that I really have the utmost respect for. So anytime she says, this person I think would be a good addition to your show, I had to. And when I spoke with you, I said, yeah, she's on the money. Dr. LuissaK has to be a part. So thank you for accepting the invitation.
My pleasure.
This time goes by so quick, so I'm going to start with some questions. Tell me a little bit about yourself and coming to the United States.
Well, it's a long time ago, about 38 years ago. The visit was supposed to be a 2-month visit and ended up being the journey of a lifetime. Definitely, a lot of things have happened during those years, and my journey has been filled with a lot of experiences, a lot of friendships, but also learning how to navigate a different system, a different culture, and recently how to help women not only as a physician but also to advocate for them.
Yes. So I love the fact that you talked about your journey. So share with me, Dr. K, your journey from trauma to triumph, especially as shared in your book that we spoke of earlier, Push, Then Breathe, which is so powerful. What was the defining moment when you realized your story wasn't just personal, but indeed you need to share it publicly to empower others?
For the longest time, I just kept my story to myself. It was part of my private life. Until one day when I realized that it really doesn't serve anyone. It doesn't serve any purpose to keep it closed, to keep it private. And that day was actually in 2012.
Okay.
Short story here. I was taking care of a patient. She was 11 years old, pregnant, and non-English speaking. And her unbelievably hard burdens that she was carrying at the time, the shame, the fear, the humility, prompt me to think, my story, my advocacy could be someone else's lifeline.
So true. And when you talk about your own experiences, don't you believe that sometimes that's God's way of when we go through things and we come out on the other side, it is to give a testament that it can happen. If it happened for me, then it can happen for you.
That's completely correct.
Yeah.
Because we tend to feel a few things. We tend to feel that we are alone.
Yes.
No one else has gone through what we go. We couldn't possibly have someone else that goes through it like us, right?
Yes.
And we're ashamed because, again, what would people think of us? I come from a culture that in Romania, we always think about what other people think. It's
Perception.
It's perception. And really is we have to switch that lens and say, how do I feel? And how can I help others realize that my story will empower them as well? Realize that they're not alone, that there is somebody else out there that can share their story, their pain, and hopefully they will bring them joy. Because really, in life, we're not born just to survive.
No.
We're born to thrive.
Yes. I love that. We're not just born to survive. We are born to thrive. I might have to borrow that. I like that. So, you dedicated your professional life to high-risk pregnancy care and complex situations. Tell me kind of how this passion kind of manifested to be able to care and how your telemed company was kind of brought to life as well.
Okay. Well, first, my pregnancies were high risk, very high risk. So I experienced firsthand how a high risk pregnancy is, being a high risk patient, but also seeing my patients how not everyone had the access, whether financial or the determinants of health, meaning far away from a big medical center. They don't have a job.
Yes.
They don't have insurance. They don't have someone who can leave their kids with so they can come to these appointments. So healthcare, Stephanie, it should not be just something of a, like only some people can have it.
Exactly.
This is a basic right.
Yes.
A basic human right.
Yes.
And when I realized that, we can, through telehealth, we can actually reach these people, whether we are in in native Indian reservations, whether we are in southern Texas, whether we are in Midwest America, we can reach these people independent of borders or geographical limitations. And that is how Telemed MFM was born.
Yes, I love that. And that was your defining moment to begin that. And that was some time ago, but we still have, I would say, medical health deserts still, to where it's still not available for everyone. But I believe that everything that you're doing is working toward it being available for the masses.
And it is necessary because we cannot take away the most basic right.
Yes.
The right to give basic, good, excellent expert care to a mother and her unborn.
Yes, I love it. So let me ask this, through your platform, Dr. LuissaK, Women empowerment, you do speak directly to women in medicine and leadership. What would you say are your biggest barriers you see for women trying to rise in these spaces, and how we can begin to dismantle? Talk about the glass ceiling and how we can crash through that.
So I see several barriers to achieve that in leadership, in medicine, in business. One is structural. Okay, we do not have yet in place ways to take down the old the old template,
Yes.
let's call it.
Yes.
These are antiquated practices that put us in a disadvantage.
Yes, it does.
Let's just think this way. Let's just take a room full of women, right? And all of a sudden, somebody says, "Well, this room is full of estrogen." When was the last time you were in a room full of men who somebody says, "Oh, this room is full of testosterone"? I have never heard that.
Never
have you?
have I ever.
Or another thing, here is a woman that comes and asserts her beliefs and gives an amazing speech. And actually, it's 100% transparent in how she thinks. She's actually called the B word, maybe, a little too aggressive. Like I was called during my residency, I was told that I'm a little too aggressive for a woman. And I wasn't sure what that meant. And, when a man stands up and gives a idea, a speech, his point of view, he comes across as very driven, and he can, my God, he came up with such a great speech. So these double standards hurt us. Another thing is internal. We women tend to self-ostracise. We think that we are not worthy or equal, so that automatically demeans us, our own eyes, just like this imposter syndrome.
Yes.
Right?
Know it well.
So we have to get over that. But how do we do that? To me, in my opinion, instead of telling someone, "Hey, just grab a chair, lean in," how about you say, "Hey, grab a chair next to me. This is the plan. This is yours. Go run with it." Give her power. Empowering people, it's huge. Empowering women, it's huge. Letting them know that they're worthy, they mean a lot, and they are equal everywhere.
I love it. And your point is well taken, because I've experienced it to where you're called aggressive instead of assertive. And that is something that you never hear a testosterone-driven bio person called. It's just a double standard. So I'm thankful and I'm grateful that you're able to make that distinction and to be able to impart that into women to help empower them, to build them up. I think sometimes it's best when people can actually see, and they can look at you and they can see and you share where you started and where you are and how you can help lead them into where they intend to be. So I think that that is wonderful. Let me ask this, because from your coming from your native country, let me ask this: your global humanitarian work is incredible. What I've read, from Latin America to Saharan Africa, excuse me. How have these experiences shaped your understanding of women's health on an international scale? Because I'm sure there's some difference between, here and abroad. And what lessons have you brought back home to the United States?
Yes, I have a pretty extensive humanitarian work, both as a professor, as a teacher, also as a clinician in women's health, OB/GYN, and maternal-fetal medicine, high-risk pregnancies. It is quite different. Every time I come back to United States, every time I step foot back into the United States, I thank the Lord for the country I live in. Because when I go there and I see and experience the hardship and the limitations, it's a striking reminder that, we can do better worldwide. However, it does not, it's not 100% all about the tests they run. Or it's not 100, because remember, we don't have there the bells and jingles that we have here. But what it is communication, respect, especially cultural understanding and respect between between the physician that is a missionary and the patients. And we need to remember that. When in Rome, you do have to remember that this is what you have. These are the tools that you can do to do well or do good in that country, to deliver medical care. But let me tell you, Stephanie, I've seen midwives who save lives with techniques brought from generation to generation to generation. But then I also saw tragedies could be otherwise preventables, that weren't used with what they had. So what I'm saying is, if we have the greatest care here in America, however, there is always room for improvement. Remember, we have to have equitable care. We have to take some of the lessons from abroad, bring them here, and remember that we could give healthcare a more equitable means. We can have our patients, access not only in high-risk pregnancy, but mental health and a chronic disease through telehealth, through enabling these patients to be able to not feel any less because they don't have the means to come to an appointment 3 hours away.
Oh, so true. When you were talking about that, here in the United States, but many years ago, I hear the stories of my grandmother, who in her rural community was a midwife. And so at that time, there were hospitals, but there weren't hospitals for a certain community. So people have to use the gifts and the talents they have when there's not medical intervention available for them. And that was that time, and still in this day, there's still sometimes that gap. I want to ask you quickly, with all of your many roles, physician, professor, advocate, author, mother, and triathlete, girl, how do you do it all? How do you maintain your sense of identity and balance? And what advice would you give for women in high demand professions trying to stay true to themselves and their calling?
So balance, it was never meant to be a static, right?
Yes.
It's not a static thing, even though when we think of balance, we're thinking of the two sides that always have to kind of stay in equilibrium. Really, it's more of a dynamic give and take, like a yin and yang, and it just bends and blends to be able for us to get this, we call it in medicine homeostasis. I can tell you that you have, as a human, as a woman, I think even more importantly as a woman, because we tend to give it all and we forget that, hey, we should have healthy boundaries here. We should be able to say no. Because,
and not feel guilty.
And not feel guilty. Because if you say yes to everybody and everything, you are actually missing on saying yes to your own self. And you will come up short. I always say fill up your cup every day with one thing that brings you joy, because that will empower you and it will keep you refreshed and really ready to take on the day. So don't be afraid to believe in yourself and give yourself some grace.
I love that. That is so sage. Just great advice to help encourage and empower some woman who is like, trying to do it all, but feeling like they're missing the bar. But your advice that it's not static. It's mutable. It moves. And we have to be true to ourselves. So, time goes so quick when we're doing this, unfortunately. But we kind of touched on your book and what your background is and what you do and offer. If someone were interested, Dr. Luissa, how would they go about learning more about what it is you do, your book, how to contact you? Can you share that information?
But easier to find more about me is by going to my websites, telemedmfm, TELEMED.mfm.com, and drluissa with double S, K.com. One is my professional medical website. The other one is my literary website. I do invite you all to check it out and sign up for my newsletter or even drop me an email.
Yes. Very good book. What you do is phenomenal in the space that you have built for yourself based on your experiences. And thank you for sharing, being obedient to the unction of God to not keep it in, but to share. So thank you so much for that. Thank you for taking out your time from your busy schedule and your practice to come visit with me here on set to be able to share what it is you do. So I just wanted to say that. And this is going to be all for this segment of the Main Health Show. We thank you for your viewership and for just staying connected. So until next time, take care and be blessed. Bye-bye. Hi, I'm Stephanie Anderson, the Alopecia Advocate, speaker, author, and host of the Main Health Show. If you're living with alopecia, struggling with self-image, or simply yearning to feel seen, heard, and whole again, I wrote this book just for you. My newest book, 52-Week Daily Devotionals and Alopecia Affirmations, Cultivate Empowerment and Self-Love Every Day of the Year, is a transformational guide to help you reclaim your confidence, restore your faith, and rediscover your beauty inside and out. Each day delivers a heartfelt devotional rooted in spiritual truth, paired with a daily affirmation designed to uplift your spirit, challenge negative beliefs, and replace them with radical love for you. This isn't just a book. It's a healing companion, a daily practice, a declaration that you matter. Your reflection matters. Your journey matters. Get ready to walk in your worth, speak your life into your reflection, and start each day with divine confidence. It's time to love who you see in the mirror every single day. You're not alone in this journey. And this book, 52-Week Daily Devotionals and Alopecia Affirmations, is your daily reminder that healing is possible and joy is your birthright. Let's walk in that together. And welcome back to this very special segment of the Main Health Show, where we've started doing something a little bit different and to bring more awareness to the cause and advocacy for alopecia awareness. We're starting to ask our guests a simple question. So Dr. LuissaK has so graciously agreed to answer a question for me. So Dr. LuissaK, when we talk about breaking stigma when it comes to alopecia, how do you think society can better support individuals living with hair loss? And what role do you think your profession plays in changing perceptions surrounding alopecia?
I will start with a short story,
Okay.
if I may.
Yeah.
In that book, it's portrayed it. So I was 20 years old. About 2 years after I came to the United States, I was going through a huge trauma, constant chronic stress, and my hair, I have naturally curly hair, so my hair started falling like bundles. So I read somewhere that shaving it's going to make it thicker. So I did. Okay. I took the razor blade to my head, not once, but multiple times. Then I let it grow out. Now it didn't grow any thicker. So then I realized that really you have to change the inside in order to make a change outside. So breaking the stigma against in your case, hair loss, has to do with someone's sense of purpose, beauty, inner beauty. Yes. And believe that really us as humans, our worth does not stand in hair. And we should not consider this a handicap. Okay? Because as a physician, my job is to take care of my patients, of my pregnant women patients who carry their unborn. But also, I'm an advocate for these women because they are high risk. So in a sense, remember, they have a handicap.
Yes.
They have different diagnoses that makes them just like women with alopecia, having something that they have to deal with. They have to excuse themselves to go to all these appointments, right? Because now people are going to be like, well, you're pregnant, now you're not as not worthy, that's not the word, as valuable, because now you have to go to all these appointments. You are not giving my company 100%. Same thing here. We think that as people or as women with alopecia, we are less worthy. We are ashamed of this particular burden. Changing perception starts with changing the conversation. Because if you come from a place of equity and inclusion and realize that really it's just as a handicap like any other handicap, right? And that should not stop you from being beautiful, bring smart, bring value to the table, bring authenticity and intentional presence. So I will leave you with this thought. Hair does not define who we are. Our strength does.
I love it.
So if we stand in that truth, that is where the real shine of our miracle of being who we are shines.
I love that. And again, this is this episode of the Main Health Show. Thank you, Dr. LuissaK. Be blessed. Bye-bye.